Thank you so much for watching Virginia This Morning Live right here on CBS-6. Chances are you know someone with a substance abuse issue, and according to the National Center for Drug Abuse, reveals 165 million or 60% of Americans age 12 or older abuses drugs, alcohol, or tobacco.
September is National Alcohol and Drug Addiction Recovery Month. So we wanted to talk with an expert. Joining us live via Zoom this morning is a great friend of the show, Dr. Hite, and we welcome her back to Virginia This Morning. Good morning.
Good morning. Good morning, Bill. Good morning, Jessica. How are you all?
We're good. That figure that Jess threw out there, 60% of Americans have some kind of issue with alcohol, tobacco, drugs, some substance abuse. Is that 60?
That's correct.
Wow.
That's correct when you think about it in a totality from adolescence up to adulthood. That is correct.
Dr. Hite, this was prevalent before these last 16, 18 months, going on 2 years, but this has escalated during these times.
That is correct. What we have seen during the COVID pandemic is a lot of people had a lot of isolation, and people who already suffer with some type of mental health disorder, they started masking it with the use of other substances, especially people who have major depressive disorder. There's a comorbidity between that and alcoholism, and that's where we've seen a spike in the alcohol use as well during the COVID pandemic.
It's a sticky situation in so many ways because we've been so isolated, and the people who might be around you to observe these things, if you as the individual suffering from this are not aware, it's hard to have identified it and then begin to seek help. Who are you seeing that's most at risk?
Everyone, to be honest, down to, we're looking at people as young as the age of 10, 11, and 12, even elementary school. What's happening is that we have a large influx of people abusing pain medications, and those medications are located in your medicine cabinet, if you will. You know, those are prescribed medications where you can get them from family members. And then we see this fad of individuals that are abusing opiate derivatives such as Percocets or Oxycontins and things of that nature that they can get from their family members who are prescribed pain medications. And then they mix that with Xanax.
All right, I want to go back to that 60% number again, and we're hearing it's like children on up. Are there symptoms that untrained people like ourselves can see or family members can pick out?
Of course, change in behaviors. You know, look at the behavior change in anyone that you are around. If they start becoming lethargic, slurring of the words, isolation, say, for instance, they'll go to the bathroom and you know they typically take about 30 to 45 minutes to get ready, but you see them taking an hour and a half, you know, and they're starting to be sneaky about their whereabouts or time lapse that just doesn't make any sense. Another thing you can look at is sweating, nervousness, jittery, stimulated pupils. These are all behavior changes that you can look into your family member and see, hey, something may not be right here.
When you begin to see these, Dr. Hite, or you experiencing these, what is the next step? Individuals who are suffering in this way often don't recognize it or don't want to recognize this, and certainly don't want to talk about it.
That's true. You know, substance use, just like mental health, can be very taboo. And then sometimes they run hand in hand. So what you want to look for is a professional who obviously specializes in mental health and substance use. For instance, my credentials, you know, you see letters behind credentials all the time and you don't understand what that means. So behind me, it says MAC, that's a Master Addiction Counselors. And then I'm a certified substance abuse counselor. You want to look for people who specialize in substance use and mental health disorder. We also have someone that's an LSATP, which is a licensed substance abuse treatment practitioner. And all of those specifications can really help you try to assist a family member who are abusing the substance. And you can always go on Psychology Today or just Google a therapist who specializes in substance use and or mental health disorders.
So in the last year and a half or so, the figures came out, FBI said murder rates were up like the most in 20 some years all over the country. And we were watching the news and we looked at one another and said, well, of course they were. We were, you know, locked in there together. They said property crimes were down. These are people that are like jammed together for a long period of time that you probably would have missed something before because you were out in the world doing your thing, but everybody was there together. You said watch the people, but you're right there on top of one another in the last year and a half. And I'm thinking maybe that's a big part of this. It's got to be, doesn't it?
It is. And the thing is that what happens is when you are forced to be in seclusion with each other, you pick up on things that were not necessarily noticeable when you were out in the free world. And so what that does is that impacts, the ability to see, hey, something is not right. How come I didn't pick up on these behaviors before? Now they're forced to be in the house, and obtaining the substance is not as easy as it was when you were able to move about freely prior to COVID-19.
And Dr. Hite, when we begin to seek treatment, what does that look like? I would imagine you mentioned 10, 11, 12, that's certainly a different approach than it could be on the other end of the spectrum of, our more seasoned or senior population, because this spans that full group.
It does. And, that's unfortunate. However, there are professionals out there. You can go on Psychology Today. You can go on your insurance apps or anything like that. There are people who specialize in younger kids, adolescents. It's a lot of adolescent substance abuse groups out there that assist those types of population, as well as up to the generic age of people. Substance use is one of those things that attack everyone and everybody. So they have a lot of resources out there to assist them.
We always learn so much when we have you on. And of course, the one thing that we've learned so far this morning is that if you see a problem or if you have a problem, then there is help out there, like people like yourself.
That is correct. Always research. Prevention is key.
Thank you so much, very much, Dr. Hite. We appreciate you taking time this morning.
Thank you. Thanks for having me again.
Absolutely. For more information on this particular conversation or the services that Dr. Lakeisha Hite provides, we'll post a direct link on our show website today by 3 o'clock, WTVR.com/VTM.
Please stay with us everywhere you are. Fun segment coming up next.